We often encounter the patients in emergency or in OPD settings where a chronic long-standing diabetic patient with uncontrolled sugar levels now tells you that, "Doctor, I'm very happy that now my sugars are in control even without medication sometimes." This may look like a good thing, but actually in a long-standing diabetes, this is an indication that the patient may have developed chronic kidney disease. This is one of the favorite questions of the seniors while on the rounds as well. It is always an important aspect to think about the development or onset of the chronic kidney disease in patients with chronic long-standing uncontrolled diabetes, where you were previously facing the situation that you are not able to control sugar level. Why this condition happen? Once the renal functions are compromised, insulin is not being secreted from the body and the half-life technically increased. So same amount of insulin works for the longer time and gives you normal or lower sugar levels as previously. Kidney also have a gluconeogenesis function that is also being lost. So next time, be careful and make an early judgment about this condition. So you will get the best outcomes if you pick this condition earlier.